Welcome to Washington. We're going to bring onto the stage the most provocative thinkers in the health arena today.
The art of disruption for me is believing that it can happen.
There's a very straightforward way to find out what people's priorities are. You ask them. And in our health system, we don't ask.
Right now, we can digitize human beings. We didn't have the tools to do that before, but we do now. We can digitize things at the cellular level, one cell at a time, and in fact, we can construct a Google map of a human being. And that is the technology that is not just changing what doctors can do through new tools, but what patients and consumers can do.
We have an opportunity to remove a false boundary in healthcare, to recognize that it's really one system and there's a false boundary between home and clinic. Wearables and the potential for tracking is one example where we might see the future starting to be played out.
I think we need to think about patient-reported data more in terms of giving people microphones and less about approaching them with microscopes. We can't just be asking people to give their data. We can't just be asking to allow people to affix them with monitors or be giving them surveys. It needs to be a mutual exchange that benefits the individual.
You take away the waste, you take away the fallout, and you're talking about the thing that everybody's looking for the next 10 years, which is seeking value. Everybody's going to be trying to figure out how to spend less money to get more.
The value discussion we've been having is about cost and concern about quality of care, but we need to focus on the value to the patient and the family and what is the best possible outcome for them.
If consumers are well informed, I think consumers would be making the value decisions. They would be driving not only how they're treated when they get sick, but also the innovation.
Data and sharing of data is a key catalyst for change.
Being very receptive to those new, innovative, disruptive companies, maybe even buy them. We've done that too.
I think it's important not to underestimate sort of the aura that's around healthcare and how difficult it is to come in.
Let's forget about how it's done at all. Let's think about the best practices out there outside of healthcare.
Look at the Amazons.
Right, and how do we do
Ubers.
that? Right, and that's what people want. It is like being on the Autobahn right now, the change. But what's going to happen in the next 4 or 5 years is going to be beyond anything we've ever seen before.
We have to stop selling stuff, pills and procedures, to selling outcomes, which includes outcomes of caring and outcomes of health. That is what our work is, and that's our opportunity.